Now, traditionally, the diagnosis of PCOS was established by something called the Rotterdam criteria. The Rotterdam criteria was established by different physician groups and essentially said you had to have two of three particular characteristics to have a diagnosis of PCOS. One of them was that you had cysts on your ovaries. That's kind of a no brainer. The second one was that you had an overproduction of something called androgens. Now, androgens are those hormones like DHT, free testosterone, DHEAS. These are the hormones that we traditionally associate with something like PCOS. And then the third was that you were having an issue getting your periods or anovulation, where you were skipping periods or not getting a period. And if you had two of those three, then yes, you got the check mark for you've got PCOS. Unfortunately, the Rotterdam criteria have fallen short, and researchers and clinicians today both are actually in agreement that we need to find a better way. For example, in this particular study, this is from 2024, so recent, right? Evidence based, common standardized guidelines for PCOS diagnosis and treatment are urgently needed. There is a problem understanding how women's health is getting impacted by this disease, and that's in a study as recent as just a few months ago. So we have a lot to learn when it comes to PCOS, and we have a lot to dig into. And we need to start widening our ability to diagnose this disease. When we think about PCOS, what most of the research seems to be pointing to is that PCOS is actually an autoimmune disease. And not just an autoimmune disease, it's a disease of your metabolic health. Your metabolic health is closely tied to what is happening with PCOS, and the roots of it go all the way back to your prenatal environment. I want you guys to think about that for a second. This is not your fault.